Welcome to Sex Care Self-Care, a conversation on women's sexual health brought to you by the She Plus Foundation. I'm your host, Patty Brisben. I'm coming to you today with someone that I discovered on Instagram Reels, and that's Dr. Jordan Emont. And I'm going to tell you, the first reel that I watched of yours, I'm like, oh my God, I absolutely adore this person. And I started sending them out to my friends, family, the staff here. And I'm like, he is amazing. I want to get him on this podcast. You bring so much information for women's sexual health. And so I am grateful that you're here with us today. For those who are meeting you for the very first time, you got to follow him, by the way, and we'll have that up on the She Plus Foundation on just exactly how you do this. But would you please tell everybody what you do on a daily basis?
Absolutely. Well, thank you so much, Patty, for having me here today. It's truly such an honor to be speaking to your community. And I was just so overjoyed when you reached out to invite me to the podcast. So thank you so much. So for those who don't follow me, my name is Jordan Emont, as you mentioned. I'm a board certified OBGYN, and I specialize in menopause care and sexual medicine with, I would say, a broad view towards women's longevity. And I think that both of those areas of specialization inform that ultimate goal, which is how do we help women to live longer and live better throughout their life.
That's what I love. On your Instagram, you do call yourself a women's longevity and sexual medicine doctor. Just exactly what led you to this menopause and perimenopause and sexual wellness? What was it that you went, oh my God, this is me. This is what I've got to do?
I think that my story somewhat mirrors the experience, I think, of a lot of specialists in this field, which is almost a frustration with the lack of training that we get as part of becoming a women's health provider in this field. And so, my personal story is I chose women's health. First of all, I chose to be an OBGYN when I was a medical student because I have always been, first of all, the kind of person who has been friends with women, and it's just been a lot easier for me to connect with women throughout my life. And I started taking care of women in OBGYN offices as a medical student. And I just loved the conversation surrounding quality of life and pregnancy and, just these major life transitions, I think are such an important part of caring for women as an OBGYN. And I just loved being a part of those moments. And so I went through residency. I had a great training. I walked out as a really good doctor. And then I started being a doctor. And literally my first patient in clinic came in with concerns of low libido and menopause symptoms. And I found myself just completely dumbfounded of what to do. In my 4 years of training at a very top institution, I had received no information about how to treat this person in front of me. And so I am just the kind of person who, just decided, okay, I need to invest in this and I need to learn how to do this because if I can't take care of these patients, then that is a huge gap in my ability to do, what I've devoted my life to doing. And so that really is what kickstarted it all. And I think since then, I've just really dove in. Starting the Instagram page was an exciting way of expanding that knowledge, in terms of being able to disseminate that to others, but also even for myself to learn. I learn a lot from making those videos. And so it's just been a fulfillment of that purpose.
I love that you are fiercely an advocate for women. And as a man, you don't find that often. And I am so excited that there's somebody like you out there that is helping so many women. And you're right. And shame on our schools for not providing more information because they're going to come across this. And, if you can't help a woman, she feels shame when she goes home. She feels like, oh my God, is it just me? And we never want anybody to feel alone. So this is why I'm so excited that you have this Instagram following, because nobody wants to feel like they're going through this by themselves. You spoke about why every man should care about menopause. How do men play such an important role in women's sexual health, and why?
Absolutely. Well, what I always say is, first of all, in regards to menopause, the experience, the physical experience of going through menopause and the bodily experience is something that women experience. But the life experience of menopause affects everyone, and that includes the men that are part of many women's lives. So that's the first part. I think that men really need to be playing an active role in educating themselves so they can be more supportive partners. But particularly in regards to sexual medicine, I think that there's twofold here in regards to how men are involved in that. The first is that we as a society invest a lot of energy and time and money in the sexual pleasure of men, and that is evidenced by the plethora of options that exist for
Mhm.
erectile dysfunction or various treatments that affect men's sexual health. But we don't even have, basic knowledge of the use of vaginal estrogen, for example, which I would argue is one of the safest medications in the world. And we don't have a female dose testosterone product that exists. And we're very limited on our options for women's libido. So I think that that's, one is that I think that men play a role in terms of being able to say, hey, that's kind of messed up. And then the second part is I think that, at the end of the day, if we're treating men, well, then we also need to be acknowledging, well, who are the women that these men are having sex with after we fix their erectile dysfunction? So that's, I think, a huge part of why men need to be involved in this conversation because they are already benefiting from that medical information, and now we need to make it more equal to apply the same energy towards women.
I couldn't agree more because, I've had women come to me in my business and have said, he just doesn't think that I'm interested. And that's not the case at all. It's like she can't get answers why she has no libido. She can't get answers why there's pain. And so I think the more that all of you amazing doctors are doing these reels and educating the public, the better it's going to be for women, and they're not going to feel this shame in the game. Um, why do you think it's important to talk openly about sexual health and menopause and vaginal wellness? How do we get past all the stigma that surrounds those subjects?
Yeah, absolutely. I think that you've already brought it up, which is that so many women in particular who are facing sexual health concerns and menopause concerns think that they are the only one that is going through that. And
Yeah.
part of why I have my page, and I think all of my colleagues who are in this world would agree, is to just spread the message that this is actually so remarkably common. When we think about genitourinary syndrome and menopause, which is the cause of a lot of sexual dysfunction, particularly painful sex after menopause, that affects 80 to 90% of women. And
Hmm.
I think a lot of women don't have that concept in their mind. There's this unfortunate reality that a lot of women's health concerns are not publicized. And so even if we think about the experience of pregnancy and miscarriage, people don't even realize how common miscarriage is. And a lot of women go through that and they think that they're the only one and something's wrong with them.
Yeah.
And I think this is the same thing that happens with menopause and sexual medicine. So we really just need to be normalizing this. Nobody has a problem talking about their high blood pressure or their high cholesterol with their friends, and they share that experience and they discuss the various treatments that have worked for them. But for some reason, when it comes to having good sex, or at the very least, having sex that isn't painful, there is the shame surrounding that. But really, at the end of the day, we're all doing the same thing, and we should all be able to discuss that in a healthy way.
Right. Because I've talked to so many women who feel like they're the only ones that have gone through it, or they've had doctors who have said things such as, "Oh, you just need to relax, get a good lubricant, or have a little bit of wine," um, and that's so unfair. That's dismissing the whole problem, because if you're not going to stay a student and you're not going to be able to help your patients, that's a problem. Um, your practice emphasizes on helping women thrive through every stage of life, including perimenopause, menopause. How do you guide someone who is entering a different stage of life And how do you help them change the routine and the way that they think about themselves? How is your practice different?
It is really hard. I'll start with that. Um, I think people at baseline are not very used to or comfortable with the idea of changing the way that they live their life, and particularly when that comes to the most basic of things like how do you spend your time, how do you eat, what types of medications or hormones, whatever it might be, are you taking? So it's difficult. And also, I think it's more easily accessible for some people versus others. And I just think it's important to say that. But if you think about all of life really is about transitions. We start as babies and then we become children and then we go through puberty and then we become young adults and then we take on a job and that is a new transition. And then we go through menopause and that is a new transition. So really, there isn't anything I think particularly controversial about the idea that different stages of your life demand different things of your body and your time and your experience. And I think that a lot of the focus of how I provide care is really just trying to identify, what are those areas that we can intervene on? What are the ways that somebody feels like for themselves they've already identified that they'd like to make changes? And how can we come up with practical strategies to do that? Because in many cases, it might be something very simple. One example, and this might seem silly, but even just drinking enough water during the day can remarkably change how
Yes.
somebody feels and even some of their lab parameters and extend their lifespan and their health span. And so that in and of itself is, can we just make sure that you have a water bottle next to you all day and you can incorporate that into your lifestyle? And if we can make that small change, what's the next little small change that we can make? So we're often not talking about drastic changes, at least not all at once, but it's a lot more of that. What are the little things that we can modify that are going to make a huge difference? And once people really start to feel and experience the changes in a positive way, they're very willing to commit to that.
I love the way you start with these little things because they are major things, and sometimes I question myself when I get home, like, why am I feeling like this? And when I go back and I think about, did I stay hydrated today? Oh no, you didn't. And so I love the fact that you're helping them point this out for themselves. As
I think
someone,
that, sorry,
go
if I could
ahead,
just
no.
jump in on that. I was going to say that I think that in a lot of these transitions, people may not even really be able to make the connection between a thing that they're feeling and something that's going on in their life. And I think that a huge part of our job as medical providers is not just to provide medical information, but also to empower people to really identify what are ways that they can feel better and then come up with practical strategies surrounding that. So that way people are really able to identify the value for themselves.
I love the fact too that you're listening to your patients, you're having conversations. And I think that there's, I hope women who, and men both, who are listening to this podcast today realize if your doctor's not having these conversations with you, it's okay to fire your doctor. It's okay to move somewhere else.
That's exactly
Um,
right.
yeah, you've got to have somebody that you connect with and somebody who does challenge you because they want what's right for you too. And that's the kind of people that I look for in my life is somebody who's going to challenge me and somebody who's going to say, you're not doing this and you could do better. And
Yeah.
so there's got to be more of you out there. As someone who educates patients and the public online, what do you think some of the biggest gaps are? And how is it that we can talk more clear when it comes to sex care and hormonal health? How can we open those doors a little bit wider?
Well, I think a huge gap actually goes back to what you just said, which is that, you shouldn't be afraid to find another provider that, is going to have the
Yep.
knowledge for what you need. I think even with that idea of life transitions and, you might need different lifestyle strategies or medications or hormone, whatever it might be, I think similarly, you might need different doctors at different times in your life. And,
Mhm.
I think that a lot of women go through the experience of, they had their most favorite OBGYN who took care of them for their pregnancies and they never want to leave them. They trust them more than anything. But as my own story would illustrate, they might not have any idea how to actually treat menopause, how to actually address sexual health concerns. And it's not any fault of their own. It's just the system that we exist in has not prioritized that, even among OBGYN training, who should be the people that really are the experts in that. Um, and so, it's not any fault of their own, but also you shouldn't have to suffer in the process of, continuing with a provider who is not giving you the care that you need. And I never want to throw other providers under the bus because I truly deeply believe that the vast majority of medical providers and doctors really want to do the right thing. They got into this business because they want to help people. But at the end of the day, if somebody doesn't have the right knowledge, or even if they do, but they just don't have the time because of the system that they exist in, you're not going to get the care that you need. And I think that you shouldn't be afraid to try to find that.
I love that. Um, I always say that sexual health it's general health, and I've had people go, "Why do you call it sexual health? Why don't you just call it health?" Um, if you could give listeners 3 to 5 just simple steps to begin incorporating in their sex care and their self care, what would that be? What would that look like?
Well, since I know that I think a lot of the people listening to this are currently past menopause or going through the menopause transition, I would be remiss if the first thing I said isn't to use vaginal estrogen. So I'll just give my quick pitch on vaginal estrogen, which is I always say that it is the safest medication that one could use for their body. I would even argue it's safer than taking a Motrin. Uh, and it is by far the best treatment for genitourinary syndrome and menopause. And you can even use it as a preventative measure if you haven't gone through this yet. Like we reviewed already, 80 to 90% of women will have those symptoms at some point. So might as well get ahead of that. It is twice a week for the rest of your life till death do you part. Uh,
And that's
and I would
awesome.
yeah, and I would say that everyone can use it, even people with a history of breast cancer, even people with active breast cancer treatment. There have been studies that have shown that it improves breast cancer outcomes. So it is just absolutely one of the best options. So that is first and foremost a practical tip.
Has it
The
been better for you since that black box label has been removed?
I take a lot of time to go through, those concerns preventatively, when I'm prescribing these medications. So I personally have thankfully not had to address many of those things. But I will say, I wear 2 different hats and I have my own practice, but I also work at a community health center. And definitely at the community health center, I have noticed a difference. I had a lot of people that used to come back to me and say, "Hey, I never started that because I saw all these scary things on the label." And I think that, is improving and there's just a lot more awareness around that. So that's a really positive change that's happened.
Just out of curiosity, is anybody giving training to women who are in nursing homes? You said death to do us part, and they should be using this. Is anybody helping those women? Because I remember when I was in high school, I volunteered at a nursing home, and so many of them, you would go in one day, they would be great, and the next day they would be crazy.
Mhm.
And they were like, yeah, she's got a UTI.
Yeah.
And I remember that happening so often. And I think about those women. It's great that this warning has been taken off. It's great. All those things are happening. But who is helping those people? Are you advocating for them too?
You are absolutely right. And I don't know of a particular person or group of people who is trying to make that happen other than, the broad coalition of people like myself, who are trying to just spread the message on the safety of this on social media. I've actually for a while now, just due to time, have not pursued this, but for a while now I've wanted to do a research study where we actually use vaginal estrogen for people who are admitted to the ICU with urosepsis, which is a urinary tract infection that turns into septic shock.
Yeah.
And, people people end up in the ICU for that.
Uh-huh.
And I've always thought it would be great and interesting to do a study where what if we start all of these women on vaginal estrogen and we look at the readmission rates? And I can almost guarantee that those people would do significantly better than the people who don't start it. So I think you're absolutely right. I don't think that anybody is actively working on that, but it 100% should be a place that we should be intervening. And also, you bring up another good point, which is that regardless of what age you are, people hear a lot of things about age cutoffs for hormone therapy. I'm happy to get into that if you'd like. But for vaginal estrogen, there is literally no concern. You can start it when you're 40, you can start it when you're 20, you can start it when you're 90. It will have a benefit if you are having those symptoms at that time or if you're about to face them.
Good. I think that that's great that because you think there's some women who are like, girl, I'm only 39. I'm not even near that yet. Well, yeah, you are. If you're having some of these problems, you might want to sit down and have an open conversation with your doctor and tell him exactly what's going on. So, there it I think sometimes people think you have to be in your late 40s, early 50s before the light bulb needs to go off. And
Yeah, and I would also add to that a common situation that people are not offered vaginal estrogen, but I think they should be, is during lactation. Because I always say that lactation is kind of like mini pause. Functionally, your ovaries are shut down by the presence of prolactin, which is the hormone that helps with milk production, and you are not producing any of your own hormones during
yeah,
that time. And any woman who has been pregnant, or most women who have been pregnant, will tell you that that first time or first few months or first year of having sex after having a baby can be extremely painful, and this is particularly true for people who are lactating. And really, it is exactly the same condition as genitourinary syndrome and menopause. Now the term is genitourinary syndrome of lactation. And so I actually start all of my patients who are lactating on vaginal estrogen. I use exactly the same regimen that we use for menopause. And the evidence would say that it helps to decrease that painful sex that is so incredibly common, but is again another situation where we just say, "Oh, you just had a baby. It's supposed to hurt, when you have sex after having a baby." I just find that to be completely unacceptable. And we need to be doing everything possible to try to make that experience even a little bit better. Even just from a personal standpoint, some of my followers would know that, my wife just had a baby a month ago. And so we're in it right now, and
yeah.
we're in all of the postpartum changes, and I can tell you that e- any little tiny amount of effort that you can make to make the life of a postpartum woman better is worth it. And this is a huge area that is very low-hanging fruit to address that.
Congratulations. And
Thank you very much.
your wife is very lucky that she has you. So that's
Thank you.
awesome. Um, what's the one message that you want every listener, regardless of gender or age, to remember about sex care after hearing this conversation?
If we expand it to think about how men are incorporated into that, and I love that you included that in the question, I think that absolutely the most important thing I want people to walk away with is that it's okay to educate yourself about this topic. I love when patients come in and they're already telling me the answer of what's going on with them. And I think that we actually exist in this really amazing age right now where people have access to AI, and that is really turning into a whole health platform. And obviously, it always needs to be taken with a grain of salt. I would never tell somebody to completely rely on that. But I think that it really presents an opportunity for you to figure out what's going on with yourself, to be able to come to your doctor and say, hey, I was doing some reading or I was listening to this podcast and they talked about, this condition. Do you think that that could be going on with me? And the same is true for men who are involved in, women's lives who are dealing with sexual health concerns. I think it's an opportunity for you to educate yourself so that way you can be an informed partner. You can participate in those conversations, and maybe even just from a very selfish level, you can not take it so personally that it's something about you or it's something about your relationship. And so I think that is just such an important thing, is that education for patients, education for providers, education for partners is just so fundamental. And it's how we change the conversation around this. It's how we make it so this is no longer a stigmatized topic. It's how we make it so women's sexual pleasure and sexual health is treated just as valuable as men's sexual health is. And so that's just my ultimate purpose in this life. And that's why I have my social media page, to be able to spread that message. But I think that you have such an opportunity to also take it upon yourself to figure out that information. So that way, when you go see your doctor, you can have a really informed conversation.
Yes, informed. You're right. I always ask this to every single person that comes on this podcast. What did I miss? What question did I miss? Is there something that happened today or you've been thinking about that you would like to share with the audience out there before we close?
It's a great question, and you had sent me the questions before, and I was thinking about it. And obviously, I had to see where the conversation was going, but I do think that always an important part of this conversation is that it's not necessarily always about the treatments. There's so much about your lifestyle that can play such an important role in not just your health more broadly, but also in your sexual health. And I think that I've been on some podcasts and I talk a lot on my Instagram page about the use of hormone therapy. And I think that there's a lot of people who just get into this mindset of, oh my God, I have to do this. I'm so behind. But there's really so much that you can be doing, even if you don't have access to that, or more importantly, there's a lot of people who it may not be appropriate to use various forms of hormone therapy. And so I think that just thinking about, how are you sleeping? How are you hydrating yourself? How are you eating? How are you exercising? That plays a huge role in your health in general. And just like we've discussed earlier, your health in general informs your sexual health as well. And so it all plays an important role. And I just want people to make sure that they know that that's a part of the equation as well.
That's awesome. I find you as fascinating with our talk today as I love watching all of your Instagram reels.
Thank you.
And if I didn't say it before, and I know I did, but I'm just going to repeat this, you guys need to follow this doctor. He is amazing. And I love that you advocate for women. Thank you so much for all that you do. And thank you for joining us today. Listeners, you can learn more about Dr. Emont on the She Plus Foundation website. If you like what you heard, please rate and subscribe to our podcast. For more information on the She Plus Foundation, go to www.sheplusfoundation.com. Remember, sex care is self-care and sexual health matters.